Hello, good afternoon. This is Dr. Garias. This is for MED260, and the topic for today is Chapter 40, Pediatrics. And you look through your Chapter 40 outline, and remember, this is only an outline. This is not a complete study guide, nor should you rely on it for the midterm exam. Not midterm, but the final. Look at the case. You can see the attending physician is Dr. Alexis Whalen, and our patient, Chris Matthews, looks like a 7-year-old male, diarrhea for 3 days. Remember your MED140. Even though you just had it before, you aced it, you still should know you should still have the ability to be able to read a case, grab up the chief complaint, remember in the patient's own words, and the history of present illness. So the HPI, as you could see here, hasn't been sleeping well, goes to the bathroom during the evening at least 3 times, diarrhea 3 days duration. NKA, no known allergies, currently homeschooled, and parents did not do immunizations. So these things are in consideration, because remember, your pediatric patient not all the time can talk, and also they're not too accurate, and maybe their parents aren't accurate as well. So let's go through some of the items. One of the things you should note on an infant is, of course, developmental stages, and as you can see here, let me just dial it here. Know when you have your anterior and posterior fontanelles. Know your basic anatomy, and know when those things should close. It is right there within the paragraph. Also know the intellectual and cognitive development, and also social development of infants. You need to know this thing right here, the physical development. Maybe I could zoom in on it a little bit, right? If you can see the physical developments, know basically what happens at 2 months, 3 months, 4 months, 6 months, 9, and 12. And if you notice all those months, that is essentially how the Department of Pediatrics separates everything. It separates things in infants or newborns, the first 3 to 4 weeks or the first month, then at 2 months, 3 months, 4 months, and then not really at 5, but typically 6, 9, and then 12. Okay? Alrighty. Psychosocial development, and it's related to intellectual and cognitive. So what's an example of psychosocial? Know that around 1 month they can smile or smile at a smiling face. They're not necessarily smiling at your face. They're just smiling. They could just be smiling because they're passing gas. They smile for no reason. But by 3 months, the smile displays and matches up to pleasure, things that they like. And also regarding intellectual, right? Know that when they start making faces, that's 4 to 5 months. So pretty much this first part of the chapter is knowing when things happen. And if things don't happen too often or too quickly, then we could start testing for mental retardation, autism, and other developmental issues. Okay, and here's a nice little chart. Again, don't memorize it, but you got to be familiar with it. Now, this thing, maybe you have noticed this from your MED140 class, and this is the height for weight, length for age, head circumference. The key thing here is, if you see this broad line right here, let me focus in on that. Okay, see this broad line here. Here is the 5 percentile, and here's the 95 percentile. So let's say we're looking at height for weight, or length for age, something to that matter. We need for the babies to have a smooth transition, and also they'll be looking for this bold line here. P50 means percentile 50, or 50th percentile. That means if your baby falls around or your child falls around this line right here, then we're good. That's what we're looking for. We're looking for a sloping graft that maybe can even grow, right? That's okay. But when it dips below that line, or if it dips here for maybe a diabetic baby or a baby whose mom had gestational diabetes, if it's all the way up here, so this is a pretty big baby here, this example here with the dots. That's already well in, it goes well in for that baby's, let's look at it, right, for their weight. If you look here on the percentile, that's well within, you know, the 85 to 90. So the baby's a little bit on the big side. Doesn't necessarily mean that the baby's abnormal, but it just states that we're looking, just like when we look for heights and weights, we're looking for trends. Psychosocial, that's very important with the diagnosis of autism. Same thing with social development. And again, right, that's not our job to diagnose, but this is the reason why we're looking at all these stages. Okay? No, let's see. Let's look. We had some examples of that. And it pretty much goes through the whole, you know, years. Now, of childhood development. Now, when we start looking for 11 to 13 years, now we're going to start looking at this. Let me focus on this. Know this. This is very important. This chart right here. That's figure 40-7. What's the same things that male and female go through regarding puberty, and what are the things that differ? Doesn't that look like a beautiful both A and B question? I think so. So that's something to look out for. Now, the pediatric examination. The pediatric examination is pretty much split into two: well baby or well child, and sick child or sick baby. Okay? Now, in a well child, we're looking for what? Again, we're looking to see if the child hit all of these developmental stages at or around. Now, if your child hits it early, doesn't mean that they're a genius, nor if they hit them late, doesn't mean they're mentally retarded. It's just that something we have to go look for. And these are the things that we typically do. Now, if you look, history and physical, we already learned that in MED260. Length and height and weight, head circumference, and that's for infants. And then we start looking for the body mass index, especially for children nowadays. Back in the day, we don't look at that at 4 years. Now we do, because remember, the diagnosis of diabetes mellitus, especially DM type 2, which is the non-insulin dependent diabetes, that is definitely on the rise with early childhood. And if I can handle a child earlier, you know, before they get into the school years, because when you go to school, you start learning all the bad habits. But once you're in school, what do we start looking at? Height, weight, blood pressure, vision, right? And if I could take care of some of that dietary constraints, dietary needs before they get into school, that'd be great. And adolescents, we're now thinking what? We're starting to think puberty. We start thinking, very, very different emotional, physical, and psychosocial aspects. All right, pediatric immunizations. You gotta kind of know this chart, and you don't really memorize it, and it's you just gotta know kind of in general when you give stuff. So, for example, I could ask the question, and I'm going to focus in on this one right here. I can ask a question: when do we give Heppy immunizations? Well, you give them at birth. Then you give another one at 1 month. Then you get another one at 6 months to 18 months. That you should be able to know in general for all the immunizations. And it goes for dip, tet, H-flu, the more common ones, Heppy, varicella. Okay? So know that chart. Let me pan back. That's this chart right here in your textbook. Now, World Health Organization and the CDC, they change this up from time to time. These are 2015 statistics, so they probably changed again. But in general, this is how they pretty much run. Okay. Now, know what the vaccine is, know what it does. What else? Let's keep to our guide here. So, I stated on the notes that it was a homework assignment. Well, we didn't make it an official homework assignment, but you could look up any changes of the immunization schedule from 2015 to current, and if there are any changes, report them to me, and that'll be for extra credit. Okay? And remember, I need a viable source. Just because someone says your diphtheria causes autism doesn't necessarily mean it's true, which, by the way, it does not. Autism is part of a developmental spectrum and has nothing to do with vaccines. Alrighty, let's look at some of these diagnostic tests. Of course, vital signs, body measurements, we already know, general eye and vision exam. We kind of went over that in last week's items. Now, if you look at this lovely young lady right here, she's putting like this star around her eye, because remember, when you do vision exams, you have to make sure that one eye is occluded, because remember how you see if, like, for example, my left eye is horrendous and my right eye compensates for the left. So you want to remove that bias. Hearing exams, and remember, a lot of the vision and hearing stuff, the screenings ramp up starting at kindergarten. Throat cultures, we know what they're for. Pediatric urine specimen, and remember, you try to get the urine specimen at all, but it's just really, really hard. And they use these little bags with these little adhesives. Here's a picture of it. And those of you who are parents, you know this bag, and it never works, and it always leaks. But you got to give it the old college try. All right? I don't like the bags too much, and if you notice, the bags also have these little measuring items right here. That's kind of important. So, because we also want to get volume. But again, if you really want to get volume, well, yeah, the best way is a catheter, but we really don't like doing that. We only like doing that in the hospital setting. Let's look at some of these common diseases. Again, this is a laboratory class. You don't need to know the common diseases. You don't need to know the treatments. What do you need to know? What are the tests? So let's get down right to it, because this is not a pathology class. Okay? What kind of tests are typical? Well, we want to, of course, detect for child abuse. And remember, we do not report. We do not call the police. We do not call Child Protective Services. We simply gather up data, inform our chain of command. The rest is up to the law and everything else. Eating disorders, remember, puberty is all about what? Perception. Right? So anorexia could be in a male or female. There are a lot of athletes who have body dysmorphism, meaning to say is what they see in the mirror. They may have a pretty awesome, young teenage athletic body, but in their eyes they are flawed, and they're gross, and they're disgusting. And it leads to what? More serious things such as anorexia nervosa and bulimia and all that. And remember, all of that can also happen in a male. Okay? Depression, substance abuse, that kind of thing. Remember, we do not call CPS, but we inform our chain of command, and we try to gather up as much data. Violence as well, fighting, that kind of thing, suicide, depression. And remember, don't just chalk everything up to puberty. Remember, use the things that you've learned, and remember, inform your chain of command, document everything. STDs, yes, STDs in adolescence and pregnancy, something to be aware of. Okay. Now we'll be going over class on how to measure instruments. Measure infants. We finally got some of that stuff in today. And if you have one of these old school weighing scales that with the infant, the same rules apply. Head circumference, how to remember that's for infants. And growth chart, and we're going to show in class again, for those of you who had me for MED260, you know that I went over it in that class as well, but again I'll go over it in this class likewise. Now the most important thing about pediatrics is you got to get on the side of mommy, you got to get on the side of the doctor, and you have to be a good liaison between the two. And again, listen with a grain of salt to your pediatric patient, because remember, after the age of 6, the child is already cognizant and also knows how to lie because they're stressed, and also they don't want to be in trouble, and they don't want to tell you exactly where it hurts because then they're afraid they might get a shot or some other unpleasant procedure. All right. That's all I got for now, and I'm looking at the pediatric physical examination. And again, we could go over the class. Though the one thing that I didn't talk about is child safety, but you can read that up on your own, okay? And please, as a little disclaimer, my notes were created from an older version of your textbook, so they might not be on the same exact page, but they should be around somewhere within ballpark. Okay? All right, this is Dr. Garias signing off. Thank you very much.